Hi, my name is Daniel Flis. I'm a board-certified otolaryngologist, head and neck surgeon. Today I'll be sharing my journey, the common conditions that I treat. I grew up in New Jersey, the son of a nephrologist, which is a kidney specialist, and a nurse. And my whole childhood, I had absolutely no interest in going into medicine, but I always admired what my dad did. I grew up liking literature and stories, and I was a comparative literature major, and I studied Japanese at the University of Washington in Seattle. And then very shortly after graduating, I had an epiphany. Just kind of hit me one moment while I was reading an article that I wanted to be a doctor, and it seemed to come out of the blue. My dad thought I was crazy when I told him that I wanted to be a doctor. But just that summer, I started at a post-bac pre-med program at Columbia in New York, and that started my journey into medicine. Initially, I was very interested in neuroscience. Went into medical school, maybe thinking I'd be a neurosurgeon or a neurologist. And then over the course of my studies at medical school, I became very interested in head and neck anatomy and had some experience rotating with otolaryngologists and really liked the variety of the work that they did, the types of conditions that they treated. Especially, I was interested in a lot of the head and neck cancer that was treated that I got to observe. And that kind of started my journey into otolaryngology. The postbac program is intended for people that finish their undergraduate training and then, just like myself, they had a change of career where they wanted to be doctors, but they didn't have the prerequisites like chemistry, organic chemistry, biology, physics. It's a kind of program that you take classes in those courses and start doing some research or volunteering in medical fields and then apply through to medical school from there. Yeah, so during your fourth year of medical school, you apply to residency. For otolaryngology, it's a 5-year program. So it includes your intern year, which is, you do spend some time in otolaryngology, but you also spend time in general surgery. I rotated neurosurgery, in emergency medicine, and in the intensive care unit. And then starting in your second year, you begin like exclusive otolaryngology training. It was an intense period where everything you're doing is within your field, not as much free time, but it's a great period because one, you bond with all of your co-residents and you're just learning so much and your skills are improving so quickly. And you're also taking, joy in being able to help people. It's kind of different from when you're in medical school and you feel like you're learning all this stuff, you're kind of maybe shadowing a little bit more. You're not really actively helping people as much. So that was a really nice period of residency. I chose after residency to do a fellowship to get more specialty training in head and neck cancer. And so that's when I came to San Francisco for my fellowship at UCSF. During residency, when you're doing everything, I just felt the most connected to those patients. It's a really critical point of time in their lives, and getting through cancer treatment is a lot. And so it just felt very meaningful to be part of that journey for patients. So in my practice, I do a lot of head and neck cancer. I see patients for neck masses, thyroid masses, salivary gland problems, but I also treat general conditions like sinus disease, sinus infections, ear problems. For instance, with like a neck mass, if you have swelling in your neck and it's not associated with obvious cold or like fevers and chills, and it's persisted for 2 weeks or more, that's really something that you want to be working on. I think in regards to the question about AI and how that relates to medicine right now, that's a rapidly evolving field. I think in this snapshot in time right now, we're using AI sometimes to help with medical questions that patients bring up. I think it does allow us to answer more questions within a shorter period of time. That's using a platform kind of rooted in medical literature with less risk of hallucinated references or information that's just gleaned from the internet rather than from medical journals. AI is also helping us kind of minimize the burden of documentation so that we could really focus and concentrate on patients and not kind of worry about finishing our notes as much. Other innovations or kind of recent innovations within our field, I think one thing that I'm doing that is a newer thing that is treating thyroid nodules with radiofrequency ablation techniques or other ablative techniques. So these are patients with benign thyroid nodules, so not cancer, but large enough that a patient is seeing it or feeling it, maybe having what is called compressive symptoms. They might feel like a lump in their throat when they're swallowing or having a a little bit difficulty swallowing. In the past, those patients would be given two options. One would be just to continue to kind of observe the nodule, follow up with their endocrinologist, and get ultrasounds at different yearly intervals, or they were given the option of surgery. And a lot of patients kind of felt between rock and a hard place, where surgery seemed a little too aggressive, but they didn't want to do nothing about it. Thyroid nodule radiofrequency ablation is a in-office procedure where a little bit close to like a needle biopsy of the nodule, where you're inserting a probe into the nodule and basically like heating up the cells from the inside to cause cell necrosis and thyroid nodules to shrink. They usually maybe have some mild discomfort the following day, but there's really minimal recovery afterwards. I mean, that's, the average patient. Of course, there are some patients at either extreme that might have no discomfort at all versus days of discomfort after the procedure. And then the thyroid nodules, I usually will see somebody back a month later, and oftentimes we'll see about a 50% volume reduction in the thyroid nodule at 1 month, and then even greater volume reduction months later. You would want to have the diagnosis of a thyroid nodule, and this isn't just any thyroid nodule, because thyroid nodules are very common, and many people have small, like non-cancerous thyroid nodules, and we wouldn't really recommend this for those patients. But for a nodule that you can see, it's usually the thyroid gland is right kind of in your lower central neck. You'd be feeling like a lump, or people would be seeing a lump in your neck. You would have an ultrasound that would confirm that there was a thyroid nodule. And then we would do biopsies prior to treating with radiofrequency ablation, just to confirm that it's benign and not cancer. What I think is great at SH Medical, one, we have a lot of providers. Although we may have more niche-like focuses, we also have the interest and ability to treat all general ear, nose, and throat problems. So when you're seeing one of us, we're interested in treating the whole patient, and you might have something wrong with your nose, but you also have something wrong with your ear, and we're able to take care of both of those. And also just a lot of great providers, great people, great colleagues. Thanks for watching. Drop a comment below.